I'm Katrina Selch, and today I'm going to be showing you how to reconstitute a medication, dilute it, and administer it via a mini bag. So first I'm just going to perform some hand hygiene. Okay, and then I'm going to look at the MAR and I'm going to pull up my medication from the Pyxis machine. So once it's all pulled up, I'm just going to be pulling up Cefoxitin, which is an antibiotic, and my patient has pneumonia, so that's what it's for. So then I'm going to do my first med check with the medication and the MAR. And so Cefoxitin, it's the same drug. It's 750 milligrams, and this is a 1 gram vial, so I'm going to be able to give it here. IV route, it's IV, and then it says every 6 hours, and I know that the last dose was given 6 hours ago, so I'm going to be giving this at 9 in the morning. And then it's also the right patient, which is Mr. Smith. And I'm just going to check to make sure the vial isn't expired, which it isn't, and that my patient isn't allergic to anything, and he's not. Okay, so once I have that, I'm going to go into my monograph, and I'm just going to make sure that the drug is suitable for a student nurse to administer, and it is as well, and that the 750 milligram dose is within the safe dose range, and it is. So then after that, I'm going to read the instructions. So it says here for a 1 gram vial, I'm going to add 10 milliliters of sterile water for a final volume of 10.5 milliliters and a final concentration of 95 milligrams per ml. So with that, I'm ready to go. So I'm just going to be grabbing my sterile water here and my medication that I already have. So first thing, I'm going to swab the sterile water, and I'm going to swab it for 30 seconds and then let it dry for 10. And then I'm going to grab my 10 milliliter syringe and attach the blunt fill to it. And then pull up 10 milliliters of air. Perfect. So then once that's dry, I'm going to do this. And just pull up that 10 milliliters of sterile water. So then once I'm at my dose here, I am just going to be getting any air bubbles out, and I'm not breaking sterility here. Okay, so perfect. Once I got all the air bubbles out, I'm just going to take this out here. I'm done with that. Put that back on. And then I'm going to swab my medication vial using the same technique for the swabbing for 30 seconds and then letting it dry for 10. So with that, I'm going to be injecting my sterile water into my medication. Perfect. With that, I'm just going to gently roll the vial between my hands, not breaking sterility. And I don't want to shake it just so I don't draw up any unnecessary air bubbles. Okay, so once I've done that, I'm just going to swab off the vial one more time just in case. And once again, 30 seconds swabbing and then leaving it for 10. Okay, so then after I did that, I'm just going to really quickly calculate my dose. So I know the dose ordered is 750 milligrams, and the final concentration is 95 milligrams per ml. So I'm just going to divide those, and that is a final dose of 7.89 milliliters, which I'm just going to round up to 7.9, and that is within my safe dose range according to the monograph, so that's good. So then once I do that, I'm going to pull up 7.9 milliliters of air, and put it here, and then pull up my 7.9 milliliters of medication, not breaking sterility. I'm just going to get any air bubbles out that might be here. Okay. So once I have my dose here, I'm just going to pull this out. Attach this. So once I've done that, I'm just going to do my second med check with the syringe and the vial with my MAR. So I know it's the right drug, Suboxetine, and 750 milligrams, which I know I pulled up, and it is also 7.9 milliliters. And then IV route every 6 hours. I'm giving it at 9 o'clock, and then also that it was the right patient, Mr. Smith. Okay, so with that, I'm going to go back to the monograph and read some more instructions. So it says here I'm going to dilute it in 10 to 100 milliliters of D5W, normal saline, or lactated ringers. So I'm going to choose a 100 milliliter bag just because I don't need the medication to be too concentrated as if I was giving in a 10 milliliter bag. So that's why I'm choosing the 100 milliliter bag. And then I'm going to be using normal saline because my patient's primary line is already normal saline, so I know that it's compatible with him. And then it also says here I'm going to administer it over 20 to 60 minutes. And I'm going to choose 60 minutes because my patient has not received this medication before, so it just gives me more time to monitor for any adverse effects that might happen. So then with that, I'm going to prepare my other supplies. So I'm just going to be getting my tubing ready and my bag. So this is the normal saline 100 milliliter bag here. So for this, I am going to just swab the port of the bag and not bring sterility. I'm going to swab it for 30 seconds and then let it dry for 10. And once it's dry, I'm going to inject my medication. Okay, perfect. So once that, I'm going to discard this in the sharps. And I'm just going to gently roll the bag back and forth just to mix up the solution. Okay, so once that, I'm going to fill out my sticker here, and I've already filled it out beforehand. So it's Suboxetine, and so the right drug, the right dose, the right volume, the dilutant concentration per milliliter, the date and time that I'm administering it, and then I'm going to sign it, my signature. So I'm just going to go and put that on the bag there. Okay, and then I'm also just going to prepare a piece of tape for my tubing so that the nurse knows when it's appropriate to change it. So I'm just going to write the date, the time, and I'm just going to signature it. So. Okay, and I'm just going to take that with me. Okay, so then I'm almost ready to go to the bedside, so I'm just going to be grabbing my my medication, my tubing. I'm going to be grabbing a few alcohol swabs here, and my MAR. So I'm just going to perform hand hygiene again. Okay, and then before or when I enter the patient's room, I'm going to do a quick safety check. So I'm just going to make sure that nothing is on the floor that he can slip on or that I can slip on, anything like that, that the room is clear. And then I'm also going to make sure the side rails are up if it's appropriate and that my patient isn't in any distress. And I'm going to double check to make sure that the IV that's running is running at the proper speed and the proper amount and that there aren't any kinks in the tubing. Okay, so hi Mr. Smith, I'm Katrina. I'm going to be your student nurse today. Can you just tell me your name, please? Perfect. And your birthday? Good. And do you have any allergies? No? Okay. So then while I'm here, I'm just going to double check the IV site to make sure that there's nothing wrong. So it doesn't look like it's, if there's any red, there's no redness, there's no swelling, it's not cold, it's not really cold. And then, are you feeling any pain in this area? And he's not, so that's good. So then I'm just going to real quick do my third med check. So then it's the right drug, Suboxetine. I know it's the right dose, 750 milligrams, and the 7.9 milliliters for the volume, which is 107.9 milliliters of volume in this entire bag. I'm giving it IV. I'm giving it at the right time at 9 o'clock, which was 6 hours ago. Last dose was 6 hours ago. And then it is the right patient because I just double checked the armband. So then from here, I'm just going to, before I do anything, I'm just going to educate the patient on the drug that he's getting. So, Mr. Smith, you're going to be getting Suboxetine today via your IV, and that's just, it's an antibiotic for the pneumonia that you have. So if you notice a rash or that you have a lot of diarrhea or any stomach pains, just ring the call bell and let me know. Okay, so now that I educated the patient on the reason and the side effects that he might have, and are you okay with me giving you this medication? Perfect. He didn't refuse it. Okay, so then I'm just going to continue on. Just gonna perform hand hygiene again. Okay. So then, when I do that, I'm just gonna spike my bag here, and I'm just gonna maintain sterility while doing this. Okay. Okay, so perfect. And I'm just, again, I'm making sure the clamp is closed, which it is. So then once I have that, I am going to swab the port, and I'm going to swab the port that is before the Baxter pump, just so that the bag is regulated by the Baxter pump. Okay, so while I'm doing this, I'm maintaining sterility. So I'd swab it for 30 seconds, let it dry for 10. Okay, so then I'm just going to undo this here. Not breaking sterility again. I'm going to attach my bed, and then I'm just going to back prime. So I'm just going to slowly let the chamber fill 1/3 to half of the way, making sure that all the medication is getting in here. Okay, so perfect. So once it's halfway, I'm just going to make sure that I hang my primary bag lower than my secondary bag. Okay, so then once I have that all set up, I'm just going to make sure all these ports are open, which they are. Okay, and then I'm just going to program it into the machine. So then I know there's 107.9 milliliters in here, and I know I'm doing it over an hour, so I'm going to be typing in 108 just because there's only 3 spots. And again, the volume in the bag, 108. Confirm that. And I'm going to start my secondary. So I'm just going to watch to make sure that a few drops come out of the chamber here. And I'm just going to ask if he's experiencing any pain or anything, and he's not, and that the site isn't leaking and stuff. Okay, so again, I'm just going to be waiting for those drops. Okay, so I do see a few drops here. Perfect. Okay, so then again, the patient said he's not experiencing any pain, but while I'm documenting, I'm just going to stay with him to make sure that he's not experiencing any adverse effects. So then when I document in the MAR, I'm just going to document that it is the right drug, and at 9 o'clock that I'm giving it, and then just my signature. And then I can also document in the IPN all that same information, plus what the IV site looked like and how the patient tolerated the medication. So then I would just tell the patient that I'm going to come back and I'm going to evaluate him again, just to make sure that the drug is working. So when the drug is all used up, I can just take his temperature again to see if he still has a fever or if he doesn't have a fever, just to make sure that that infection is getting better.